The Virginia Cable Telecommunications Association and your local cable provider presents Cable Reports. Join us now as Cable Reports brings you up to date on current issues facing the Commonwealth through discussions with your local legislators and other policymakers from across Virginia.
From the General Assembly and the City of Richmond, I'm Woody Evans for Cable Reports, brought to you by the Virginia Cable Telecommunications Association and Comcast, connecting Virginians to their government. We're pleased to have two members from Martinsville, Henry County with us today. Senator Bill Stanley, good to see you again,
Great
sir.
to see you again, Woody.
Delegate Danny Marshall, good to see you.
Thank you. Thank you so much for letting us do this.
Great. Talk to us about the economic circumstances that your counties and jurisdictions find themselves yet in, given the Great Recession. Of course, you've gone through this for quite a period of time.
The Great Recession started a long time before it started in the rest of the U.S. I mean, it was because of NAFTA, and it started probably back in the late 90s. And so we have gone, downhill as far as job loss. No fault of the people, the good people at home who made some of the best furniture, some of the best textiles in the world. But NAFTA, when cloth is 20% of the cost is labor, and they can go to the China, and where our folks was making $12 an hour, they make it $8 a month. It just takes all the jobs out. Ross Perot said there's going to be this giant sucking sound, so it did happen. But we're making some progress, and we're getting base hits. We got a long ways to go. We've had some good job announcements in the last few months, and I think we got some more coming.
Tell us a little bit about your district, size geographically and the diversity that you represent.
I have the 14th House District, which is all of the city of Danville, the southern part of Pennsylvania, and the eastern part of Henry County. So as we talked about earlier, it's mainly a manufacturing in the past and agricultural based economy.
Senator Stanley, you have a much larger district. I think you've got about 200,000 constituents.
210.
All right, and I take it that the same economic circumstances affect your constituents.
My district stretches from Galax to Halifax, all along the North Carolina border. Includes 11 different areas, and it's diverse in terms of it can be rural. We've got mountain area. We certainly have a lot of agriculture and forestry business, and then we have the cities of Martinsville and Danville that have been the center points for textile manufacturing and tobacco, as Danny was just talking about. So it's a larger area because as the years have gone on and the jobs have gone away, our populations have decreased when we're seeing increases in Northern Virginia populations. So Danny's district seems to get a little bigger every 10 years. My district has gotten bigger every 10 years. So we represent, I think, the pride of Virginia. We always like to remind people here in Richmond that actually we were the economic driver of Virginia, textile, tobacco, manufacturing. We helped build Virginia when Northern Virginia and Hampton Roads were small towns. I lived in Northern Virginia when my dad was in the military. In 1978, the number one industry up there was cattle, dairy. Dairy. Military industrial complex jobs came much later. But we would come down to Southside where our family was from, and this was the place to be. And Danny and I work very hard to make sure that it's the place to be again. We're not asking for handouts here in Richmond. We may need a hand here and there, but we know that we can do it ourselves, and we're coming back, and that the sun is rising over Southside Virginia once again.
So a hand up rather than a handout.
Exactly right.
I think we discussed earlier the statewide average reported unemployment rate is about 4.8%. What is it in your district?
Well, it depends on what city or either county you go to. It could be either double that or even almost triple that. Wow. In certain areas. And I don't represent Martinsville, but Martinsville is probably at 12% the last I saw. And but that sounds high, and it is high. But it wasn't too many years ago that it was above 20%. But the real fear is that how many people are not looking for jobs now, or either have just moved. The population has certainly dropped You know, as Senator Stanley was talking about, you know, when we went through redistricting, not only is the city of Danville, say for example, lost population, where so many other areas have gained. You know, in the issue is not just the manufacturing jobs we lost. It's the people who supplied those companies. Mm-hmm. It's the supply houses. It's the barbershops. It's the mom and pop grocery stores that supplied those. They're gone too. So again, we're making progress. I'm not trying to be doom and gloom here, but we are moving forward.
Well, you spoke earlier about some economic development initiatives. Talk to us in a little bit more detail about those.
Well, one of the things that we're very, very fortunate to have in our area, and if you see former Senator Charles Hawkins, give him a big thank you, and also former Delegate Whit Clement. Mm-hmm. They started the Tobacco Commission. It is non-tax dollars that came from the tobacco settlement in the late 90s. Senator Stanley and I are members of that, and so one of the main thing is trying to get jobs and prosperity back to our part of the state, and we do that, and a lot of times we have to invest money today for returns that are going to be later down the road. For example, in Henry County, we have invested funds for Commonwealth Crossing. It's a large industrial park, about 1,000 acres. And that is being graded as we speak. It's on 220 south of in the county, right at the Virginia-Carolina line. And so the economic developers tell me that we're getting some calls about that now. And then just east of there in Pittsylvania County in Danville has a project called Berry Hill. It's 3,500 acres of land. Reason being that we're doing these are called mega sites, and the reason is because Volkswagen, for example, looked at us, and we did not have a site large enough for them. Caterpillar looked at us, and a couple of other large companies looked at us, and we didn't have a site, so we're not going to go through that again. So the whole idea is to have these sites ready so that when the next large company comes through that are going to pay exceptionally good high salaries with good benefits, that's what we're trying to get ready for.
So this is a way to help create this new economic environment that a lot of people are talking about, getting us away from the federal government's largesse, so to speak.
Well, you know, unlike Northern Virginia and Hampton Roads, we're not so dependent on the federal government. So what we're doing is creating environments for new industry to come in, advanced manufacturing, just as Danny was saying. We are building the infrastructure for those companies to come in when they start to expand, when they bring that money from overseas back into the United States. We want to be competitive to make sure that we have a chance of bringing them to Southside Virginia. Part and parcel of that is making sure that we have a trained workforce. I've said before, we educate our children K through 12. We spend about, between state and local money, about $120,000 to $140,000. When they graduate from high school, they leave because there's nothing there for them. But what we're doing with our community colleges, the New College Institute, and other educational institutions that teach the trades, certificate programs, offer college opportunities, is we're training the new workforce that's rising up out of our high schools so that they're going to be ready, willing, and able to work when these companies come in. I know Danny, when he and I talk to companies, the first question they ask is, how's your workforce? Are they educated? Are they ready? And the new jobs that we're trying to bring to our area are not unskilled labor jobs. They require skills. And so we're teaching our children in Southside and Southwest Virginia in a way that we're giving them those higher skilled education that will provide higher skilled, higher paying jobs and jobs that will last. We're not looking for a small, quick fix. I know Danny and I both think that this is a solution that's going to take time. But I'm going to tell you right now, it's an honor to serve with Danny because his focus, like a laser beam, has been about jobs. I call him Danny Jobs, as a matter of fact, but he really should be given credit, and I enjoy working with him on making sure we're bringing jobs back to the area and keeping our people here.
And of course, Delegate Marshall, those community colleges are also a way for those adults who have lost employment to gain other skills.
We are very, very fortunate in Southside Virginia to have two wonderful colleges, Danville Community College and then Patrick Henry Community College. Over at Patrick Henry Community College, the new president there is, if you look at her resume, she is exactly the right person at the right time in the right place. She had an economic development background. She also owned and operated her own business. And Dr. Godwin is a firecracker and really is focused in on creating jobs. And so one of the things she wants to do is to make sure that the skill level of people that are needed can get those skills at the community college. Then the next thing is, like Bill was mentioning, is that the community college is working with the New College Institute that both of us are a member of the board, and we have started something called a Center of Excellence there, so that for, say, welding, that you can go to the community college and get your certificate, but then you can come to the, when we finish this, the Center of Excellence at the new college and get your certificate that can be recognized by, it's called NIMS, for any group in the U.S. And so it really raises a level of our skill levels, so it will be able to attract new companies, and it's already attracting companies.
Great. Is that the institute that former Senator Wampler is now heading?
That is, and we've been very grateful for his leadership, and he's done a wonderful job taking NCI to the next level. He's going to be retiring pretty soon, but he's going to stay on and consult. We'll be sad to see him go. But he's brought us to a point now where I think we are about to hit that high speed that we need to. We're on the cutting edge of education right there through NCI. The student body is growing. The opportunities for them in different fields and disciplines have been increasing. And the focus on advanced manufacturing and our new building, which was just dedicated not too long ago, really puts them, I think, as a centerpiece of the job training and the education and the workforce training that Danny and I have been talking about. And that's very attractive to companies when they see that kind of commitment that the community is making and that the government is making, both at the local and state levels. Then they know that this is not a fly-by-night thing. This is a real commitment to put our economy back together and to help these companies succeed and grow.
Is it also, go ahead.
Woody, the main thing is people. Is that every locality has land, every locality has water, every locality has sewer. We do have an advantage, but it's because of if you look at our location, you can be within a 1 hour's drive of 60% of the population of the U.S. But the main thing is we want to have a skilled, ready, trained workforce. Is because that's what will separate us. If you talk to economic developers locally, if you talk to economic developers all over the U.S., they will tell you that it is the people that make the difference. And so what we want to do is to have a workforce that is trained and willing to go into these jobs and do them. And so it's already working slowly. The other thing that maybe for you people back home is the timing is also right with, I know that since the last time we talked last year about how much gas prices have gone down, and that's great for our citizens back home, but also natural gas has gone down also. So there's a whole energy revolution here in the U.S. that's going to attract companies from off the shore back into the U.S. That high energy demand companies because of our low energy costs. So we have low energy, we're going to have a well-trained workforce, and we're going to have the infrastructure there. So we put the pieces of the puzzle to hopefully get us back.
Senator, do these institutions also provide an opportunity for returning veterans? For example, those who have gained a lot of experience abroad, maybe they were a medic, for example, and they need certification in order to become an emergency medical technician. Do these institutions provide those opportunities as well?
Absolutely. We are probably number one in terms of retaining veterans in Virginia. And because we have, of course, our naval bases and other military installations, and of course, if you're working at the Pentagon, chances are you're going to live in Virginia. So we have a high number of veterans. But what our community colleges are trying to do is reach out to them and make sure that when they re-enter the workforce after serving our country and protecting our freedoms, that we provide them the opportunities. We always say, hire a veteran, you can't go wrong there. But one of the bills that's coming through the General Assembly, which I think is a good one, is making sure that those veterans, when they've taken the courses, that the military requires so they can and be a nurse or a specialist in some field or another, that we give them credit for that as if they went to another school. So and that would ease the financial burden of getting a 2-year or 4-year degree. That would certainly allow them to get into the workforce after having that bit of education more quickly. And so I think that's a great way where we can show our appreciation for what they've done for us and also recognize the skills that they already have when they enter community colleges and our public university systems.
Doug, go ahead.
Yeah, so if someone back home is already a veteran, and I think there's already a program called Troops to Trucks. So if you were a truck driver in the military, and you can take that and apply and get a CDL, commercial driver's license here, and commercial driver's license, truck drivers are in high demand right now. So there are skills available already. So again, if anyone sees this and they have any questions, either call Bill's office, either my office. We can help you and get you to the right people.
Great. Let's talk a little bit about some specific legislation that you are pursuing this session.
Sure.
There's one dealing with coal combustion residuals. Talk to us about the genesis of that and what that bill will do.
Well, let's go a little bit of history. Almost a year ago, I'm sure the folks in Martinsville, Henry County saw what happened to Danville and in Pittsylvania County downstream is in the Dan River that flows through Danville, and if you go upstream, it goes through Eden, North Carolina. In Eden, North Carolina, there was a abandoned coal ash pond. Duke Power had a coal fired generator there at one time. It's natural gas now. So that coal ash was sitting in a pond next to the river. There was a pipe running up underneath it. The pipe, was metal pipe, deteriorated. Coal ash went out into the river. The river normally is muddy red. It turned gray, and thankfully, the person downstream at the City of Danville's water treatment plant saw that the water, there's a clear tube where the water comes through, and he saw this, and he was trained that, what to do in this situation, and so the citizens of Danville never experienced any problem. But what the bill that I put in says that if someone is, either controls that coal ash, either because of electric utility or either a landfill, if they have a spill, they have 1 hour to report it to the Department of Environmental Quality, and then DEQ has 1 hour to report it to anybody downstream who receives water out of that river, but they also have to report it to the media because I wanted the citizens to know what was going to happen.
Right. So how has that been received by your colleagues?
It has to come up before committee, but I think that it will be received well.
Great, great. Senator, talk to us about some of the initiatives that you are pursuing in terms of access to health care. I know you've got several bills in. There are some really interesting alternatives that you are proposing that I'm sure our viewers would like to hear about.
Well, after last year's Medicaid expansion debate, where fundamentally we believe that expanding Medicaid will cost the state in the long run billions of dollars, I wasn't satisfied with just saying no. I wanted to find alternatives because one of the things we have in our area is rural health care it needs reform, and people need access to quality health care. And that access and the effectiveness of delivery should likewise bring down costs to the consumer and to those that even buy premiums. So I did a 2-day tour of my district, visited with every kind of health care provider you could mention, from a doctor to a hospital to a nurse practitioner. From that, I developed these bills, which we're trying to change the way healthcare is delivered for those existing Medicaid patients, to make it a patient-centered home environment where instead of the patient presenting who has Medicaid in our emergency rooms, which is the highest level of care and the lowest level of reimbursement. So let's say they have the flu and they go to the emergency room. That's $600, $700, $800 to our rural hospital, but only $30 reimbursement for Medicaid. So when it comes down to is that's not quality care. So what we're trying to do is bring out that kind of managed care to the people at their homes with telemedicine, telehealth, telepsych, making sure that they have a constant collaborative effort to where they're going to want to manage their own care and that it's going to be safe and effective for them and cost effective. The problem with Medicaid is it is care, but it doesn't assure quality of care. In our area, 50% of all doctors don't accept Medicaid, and of those that do, over 50% of them are not accepting new patients. So that really limits the ability of those who have Medicaid to access quality health care. So we've got to reform the system to where the emergency room is not the centerpiece of where they get treatment, but rather we have a lot of chronic conditions, COPD, diabetes, and what we're seeing is they're presenting in acute conditions where their disease has gotten out of control. They have to be brought and treated in a way, but then they've got to go manage it. What we're going to try to do is start, so we're managing care, we're limiting those kind of things that will get out of hand, and making sure that they're living healthy, happy lives, and really, which will bring down the cost. So a lot of that is what we've been proposing. One of my bills is to provide scholarships for those primary care physicians that are willing to come to Southside, Southwest Virginia, rural areas, underserved, underprivileged. Most of them don't come down and they're not primary care physicians because when they graduate from college and law med school, they've got I think the average is $160,000 worth of debt. So they want to go to Northern Virginia and get paid more. What we want them to do is be able to come into our area and practice medicine and know that we will help them for the commitment they make to us. We'll make a commitment to them to help them take care of their debt by giving them a scholarship so they don't come in so heavily laden with debt. Our average age of primary care physician in our area is 57 years old.
57.
And they're not being replaced. If you look at it, a lot of our people have to drive 50, 60 miles just to see a primary care physician or go to a hospital. We want to increase that community of primary care physicians and therapists so people, again, have access to quality care, effectively delivered and at a lower cost.
You used the term collaboration, and I think that's a key in terms of coordinating the care of a particular individual, because as you know, many times as they present in the emergency room with a chronic illness, there's no follow-up in terms of whether they take the prescribed drugs, whether they alter their diets and things of that nature. So I congratulate you on pursuing that.
Thank you. Telemedicine, telehealth like that, and telepsych keeps a monitoring, and it can be done over the phone or through the internet, and it may not be person to person, but the access from the patient to someone they may need is there. But likewise, the doctor can call you up and say, are you taking your insulin shots? Are you monitoring your diet? Let's go weigh you. They can do things over the phone and through the internet that were not available before. And ultimately, what we're talking about is reducing the number of times they're going to present with a bad condition to our hospitals.
How are your K through 12 institutions doing in your district, and what's the impact budgetary-wise this session? I know that apparently we're going to hold K through 12 harmless, but if you look at inflation, they're missing a lot of dollars compared to 2009.
Well, and I think the governor did the right thing, is to hold K through 12 harmless. I mean, we talked about workforce development. And, these are the workers of tomorrow, so
right.
we've got to make sure that they have the skills so that they can be qualified for the jobs of tomorrow. So we have some very, very dedicated people throughout our region. The teachers in the classroom, we need to make sure that they have the resources, and so that we work to try to get those resources to them. If I could expand a little bit on
Sure.
what Senator Stanley was talking about, something that the Tobacco Commission we have done, and maybe Bill will also want to talk about Dr. Boaz project over in Martinsville, but Tobacco Commission that we both are members of, we have funded about $9 million for some clinical trials with Massey Cancer in Southside Virginia. We did about another $8 million with clinical trials of cancer out in Southwest Virginia. We have the highest cancer rate in the state.
The highest cancer rate in the state.
Yep.
Wow.
Throughout, and so the other things we have done is we've funded telemedicine, like Bill was talking about. So we are also trying to get jobs, but we also got to make sure that our citizens back home are safe and get healthy. So we also funded a medical college over in Lynchburg that's going to have physicians on the ground in Danville, Pittsylvania County, Henry County, but we also have just funded a new startup school that's going to start in Martinsville that maybe Bill might want to speak about.
Go ahead.
At the Henry Acropolis School of Medicine, Dr. Boaz has a really revolutionary way of teaching, and it's teaching primary care physicians who will then be in areas such as ours. And he has such a dedication and focus. He should be commended for that. And we took a look at it, and we've decided that we're going to support that. We're letting the first piece of funding come through the Tobacco Commission. I think I've discussed this with members of my caucus. Next year we may look for some state funding. Of course, it's not a state school just yet, but we want to support those kind of schools that innovate, that teach not to teach with a large amount of debt, but teach you how to be a primary care physician, and especially in an area such as ours, because our needs, our medical needs, are not the same as those in Northern Virginia or on the Eastern Shore or Hampton Roads. And so what he's doing, I think, is innovative, and it shows a dedication to our community that is commendable. I can't wait till the first medical student graduates, because I think that, in terms of rural health, will show that we are turning the tide.
Great. Transportation, Interstate Transportation Compact. I know you have a bill in on that. Tell us what that does and why.
Well, I was named chairman of the I-73 Subcommittee for Transportation in the Senate, which was a bill I carried last year. And that is to develop a strategy for the building of Interstate 73 through Southern Virginia, Martinsville area, Henry County, up through Roanoke into the West Virginia border, from the North Carolina border to the West Virginia border, all the way up to Canada, basically. This would join, this highway, which is being built by North Carolina and South Carolina, would join us to the deep water ports of Charleston, and would really provide an interstate transportation that would really fuel, I think, business in our area. The Chamorro Study Group said that the building of this road would result in 43,000 new jobs, sustainable jobs, in that area of Virginia.
Wow.
So that's why I think we're now dedicating ourselves to finding a way to build this project. We're going to have to find $4 billion. That's not insignificant. But this interstate compact joins West Virginia, Ohio, North Carolina, and South Carolina through a federal agreement so that we can collaborate and work together and find federal funding, not as one state trying to build a section of the road, but as 4 or 5 states building the whole federal highway called I-73, I-74, and I-75. So I'm very excited. We've got support. They're filing bills of the exact nature in South Carolina, North Carolina, West Virginia. That interstate compact passed out of Committee of Transportation unanimously, so it comes to the floor in about 3 days of session. So I think what we're doing is now building partnerships where we're not competing, but we understand we have common goals, because this highway will be a tide that is rising that floats all ships.
Great. Let's talk a little bit about perception versus reality. Ethics reform. There's certainly a perception within the public that something needs to be done here in Richmond. There are a number of proposals floating around. There were proposals last year. How do you think things are going to turn out?
Well, I'm not quite sure yet. By the time this maybe is aired, we will have something voted on. But we still got about this end of this week and all of next week's to go. There are several different proposals, like you said. There is proposals that in the House, from no gifts all the way up to $250. I think the one that I think will probably go forward is $100. I have a little sign in front of my office door that Danny Marshall accepts no gifts. Thank you. So I just think that it's just sometimes it's just too hard to explain. I got an event last year that I was offered, and they gave me an award. The award plaque was valued at $110. I said, thank you very much, but I can't accept it.
We're going to have to end it there. Thank you for being here, Delegate Danny Marshall and Senator Bill Stanley.
Thank you.
Thank you for watching Cable Reports, brought to you by the Virginia Cable Telecommunications Association and Comcast, connecting Virginians to their government. Until next time, I'm Woody Evans.